Tēnā koutou katoa. Greetings to you all. Good evening, everyone, and welcome. It's wonderful to see that so many of you have joined us for the launch of the 2021 Dementia Economic Impact Report, or the DEIR for short. Hello, my name is Claire Hind. I'm the new chair of Alzheimer's New Zealand and your MC for this evening. Our aim tonight is to keep the event brief but very informative, and to give centre stage to Associate Minister of Health, the Honourable Dr. Aisha Verrill, to formally launch the report, and to Dr. Itu Mao and Dr. Macarena Dudley from the University of Auckland, who were part of the team that compiled the report. Alzheimer's New Zealand Chief Executive Catherine Hall will also say a few words about how the findings of the DEIR further underline the need for urgent government action on the funding and implementation of the Dementia Mati Whawhiwhawi Action Plan. I'd like to extend a special welcome to Paul Hunt, Chief Human Rights Commissioner, and Paula Tesorero, Disability Rights Commissioner. In the audience tonight, we also have Alzheimer's New Zealand patron, Dr. Richard Fall, and Alzheimer's New Zealand champion for dementia, Dame Kerry Prendergast. Welcome. We're also delighted to welcome our colleague from Alzheimer's Disease International, CEO Paola Barberino. Welcome also to Dr. Ashley Bloomfield and Claire Perry from the Ministry of Health, and our parliamentary Friends of Dementia. Also welcome to our colleagues from our partner NGOs and member organisations of Alzheimer's New Zealand. Before I introduce our speakers, just a few reminders about this webinar. As an attendee, your video and microphone are turned off. As an attendee, but we still want to hear from you, so that if you would like to answer a question, please type it into the Q&A box at the bottom of your screen. Please let us know which speaker your questions are for. We do have time for some questions at the end of the speakers, so please use the question and answer session during the speaking sessions. This ensures that Lynetta Russell, our clinical advisor, who is moderating the questions today, gets the chance to ask as many as possible. Before we begin, just a quick reminder for our speakers. Please mute your microphone and turn off your camera when you are not speaking, and turn them back on again when you want to rejoin us on the screen. The Minister has joined us, but unfortunately she won't be able to answer any questions tonight. The fact that she has agreed to launch the 2021 DEIR for us indicates a positive level of interest in the issues facing New Zealand's dementia community, as does her willingness to address our upcoming conference. We remain hopeful that this willingness to engage points to some good news in the near future. There is no denying our dementia community is in desperate need of some good news about some kind of plan to address the issues that people living with dementia and their care partners face. The dementia journey in New Zealand is often long and not for the faint-hearted. I'll leave Catherine to talk a bit more about that. And it is currently made very much tougher by the lack of anything approaching anywhere near enough services and support structures. NGOs like Alzheimer's New Zealand can only do so much with the very limited funds that we raise in the community. We'd love to be doing more. I saw a quote recently which resonated with me. You cannot scale a 100-metre wall with a 10-metre ladder. This is the reality in the dementia space at the moment. Hopefully the government will put its hand deeper into its pockets very soon. They cannot rely on organisations like ours and our ability to fundraise to provide the support that people with dementia and their care partners need. I would now like to introduce the Chief Executive of Alzheimer's New Zealand, Catherine Hall. Most of you will know Catherine and about the amazing work that she and her team do. Catherine, would you like to speak now, please?
Kia Claire, and thank you. And tēnā koutou katoa, ko Catherine Paul tōku ingoa. Well, I want to start by saying that the lives of people living with dementia matter. You might think that that's obvious and that I don't need to start there, but that isn't how it feels to me, because I know that if I'm worried that I or somebody close to me is developing dementia, then I'm probably not going to be able to get a diagnosis when I need it. And even if I do, I'm probably not going to be able to get the help and support that I need. What I will do, though, is I'll experience firsthand the stigma and discrimination associated with the condition, and it's very likely that my rights will be ignored or overlooked. And it's also worth just picking up on the point that Claire made. So Alzheimer's and dementia organisations across the country are providing vital community-based services for people living with dementia, but they're really struggling. And all of those things are only going to get worse as our population continues to age at an unprecedented rate. And we also know from this report and other research that that is going to be an even bigger issue for tangata whenua, Pasifika and Asian communities, because those populations are ageing faster than the general population. So what all of that means is that the number of people living with dementia is growing rapidly. And that's very clearly reinforced in this updated Dementia Economic Impact Report, and we'll hear about that shortly. But I say reinforced because the statistics around dementia are pretty clear and have been for some time. And that's because this is the fourth of these Dementia Economic Impact Reports that we've commissioned. And they've all been very clear about the size and scale of the challenge that dementia presents to Aotearoa New Zealand. And no one's disputed that and nobody's challenged it. Now, of course, some things have happened in response. So in 2013, the New Zealand Framework for Dementia Care provided some really useful guidance for our DHBs on what's needed. And in 2017, New Zealand, along with other member states, signed up to the Global Action Plan on the public health response to dementia. But that's pretty much it. So here we are, we have hard and fast evidence of a major fiscal and societal issue that is affecting a large and growing proportion of our population, and a proportion that includes populations who are already experiencing significant impacts of health equity issues. So what are we doing about that? Well, the answer seems to be not very much. We aren't responding to that challenge, and as a result, people living with dementia, a very vulnerable and marginalised population, are falling through the cracks. And we think that's pretty extraordinary. Our view is it's time for action, and it's time that people living with dementia got the help and support that they need. Now, we've all got a role in that, so we can all do our part in making sure that we stay connected to the people that we know and love who are living with dementia. We can all help to raise awareness of the condition and the impact it has. We can also do our bit by making sure that we look after our hearts and we take care of our well-being in all the senses of that word, so that we reduce the likelihood that we might develop dementia. And if we run organisations or businesses, we can make the changes that mean that we can do better for our clients and customers and staff who might be living with dementia. But while we can do all of those things, and they are important, the reality is that governments can do so much more. And I think that we all know that we're not going to be in a position where we will have really effective health promotion programs or nationally consistent and timely diagnosis, or indeed more and better services without a plan. So luckily, we worked with our partners in the sector to develop one earlier, and that plan is called the Dementia Mate Wareware Action Plan. And we developed that so it could act as a blueprint for government to act. Now, I mentioned earlier that this Dementia Economic Impact Report is the fourth of these reports that we've commissioned. And each of them has provided really important information that our health system has relied on. But I very much hope that this is the last time that our health system will rely on us, a small and yes, a poor charity, to deliver such essential information. I very much hope that this is the report that prompts action and delivers the Dementia Mate Wareware Action Plan. So this year, the report has come alongside the 2021 World Alzheimer Report, which this year was on diagnosis, and that was released last week. Now, that report tells us that globally, only around a quarter or 25% of people get a diagnosis. Now, here in New Zealand, we think that that number is probably closer to 50%. But either way, that's a real problem, because getting a diagnosis is just so important to being able to come to terms with what's happening to you, to be able to plan for the future, and most importantly, to be able to get the help and support that you need. But that report on diagnosis made one other really important point, and that is that all of the breakthroughs that we hear about so often these days could result in a very significant increase in demand for diagnosis. And that in itself will put real pressure on underprepared health services like ours. So we do worry, quite rightly, about the possible impact that COVID will have on our health system. But dementia could have equally significant impacts, and we just are not ready, which once again reinforces how important it is that we have a national dementia plan. So look, in closing, I want to say a very big thank you to the team at Auckland University for this really, really useful report. Thank you for that. And I know that Etu Mao and Macarena Dudley are very much looking forward to sharing the findings with you very soon. But finally, to Minister Verrill, we were very grateful, and we are very grateful that you agreed to launch the report for us this evening. We're very much looking to your comments very shortly. And we're also looking forward, Minister, to hosting you at our conference later this year. Well, Alzheimer's New Zealand and our colleagues and partners in the dementia community, we were so excited when your government made its manifesto commitment to work with us on the implementation of the plan. And you've been so supportive and engaged with us when we've met with you, and we thank you for that. And yes, we do know that COVID is quite rightly a health sector priority, as is the rollout of vaccinations and, of course, implementation of the health sector reforms. But hot on the heels of those priorities is dementia, and there is now a really urgent need to act and to address that challenge, because it isn't going anywhere, it's not going to go away, and it is only going to get worse. So support and engagement is wonderful, Minister. Thank you for that. But now is the time for action. The tens of thousands of people living with dementia around New Zealand need help now and in the future, and they are relying on you to deliver that help. Kia ora koutou. Thank you very much.
Thank you, Catherine. Some really important words there. And yes, it is a tough journey for people with dementia. And we cannot lose sight of the fact that the diagnosis doesn't change the importance of your life, that it still does matter, and that you still deserve to live the best life that you can. So now it gives me great pleasure to introduce Dr. Aisha Verrill, Associate Minister of Health, and also Minister of Seniors, but she's here as Associate Minister of Health. So we do have a very warm and cordial and productive relationship with you, Minister, and we look forward very much to hearing what you've got to say tonight. So welcome, and the floor or the screen is yours. Thank you.
Ina mana, ina reo, ina iwi, tēnā koutou katoa. Ka hori ngā mana whenua o te rohi nei, tēnā koutou. He mihi hoki ki a tātou ko a taimai nei I raro o te kaupapa o te rā, nō reira tēnā koutou katoa. Well, thank you, Catherine, for that warm welcome. And I'm very glad to be here to launch the Dementia Economic Impact Report 2021 in what is World Alzheimer's Month. I would like to acknowledge the team at Alzheimer's New Zealand, particularly Claire Hind and Catherine Hall, for the mahi that's gone on into organising this launch, particularly during the uncertain time that we're currently in. I'm very sorry that I couldn't host you here in Parliament like we had planned. I'd also like to acknowledge the research team from the University of Auckland who produced the Dementia Economic Impact Report. I'm making my way through your tables and I'm looking forward to your presentation later. And to my parliamentary colleagues who are here today, very warm welcome. As Associate Minister of Health, dementia is one of my priorities in my work around the health of older people. It's in this role that I've had the chance to meet with Catherine and her colleagues from other national dementia NGOs. And I'm very much looking forward to catch up that we plan for tomorrow as well. It's great to have this opportunity to support the work Alzheimer's New Zealand is doing to improve our understanding and management of dementia through improved data. I want to talk about the important role of that data for a country with a growing and ageing population. But first, I want to make it clear that the lives of people living with dementia do matter. They matter immensely. We must treasure our kaumātua. They are a taonga, they enrich and contribute so much to our society. I know many of you will be here today because of people you love and care for who are impacted by dementia. And similarly, I am motivated in my work by knowing the care my grandfather needed when he had dementia. And it's the same care that I want to see other people enjoy. This government took action to protect people living with dementia during the COVID-19 pandemic in a way which other countries failed to do. In fact, other countries were dismissive of the needs of older people at times during their pandemic response. People with dementia are amongst the New Zealanders who we prioritised for vaccinations early in our vaccination rollout, when we struggled with limited supply. I'm really pleased today that we have hit 93% first vaccine doses for people who are over 65, which would include many of the people, but not all, with dementia. And we have been focused on ensuring their safety as people who are among those most at risk if they catch the virus. It is a Labour Party manifesto commitment to support the implementation of the Improving Dementia Mate Wareware Services in New Zealand Action Plan, because we recognise the significance of this health issue and the need to act. New Zealand's population is ageing, growing and changing, and along with the many opportunities this brings, this also poses significant social and economic challenges for the health, disability and social systems. Over the next decade, the size and diversity of our older population will increase significantly. In fact, older New Zealanders are the fastest growing age group in the country. The number of New Zealanders aged 65 and over at the end of June was just over 819,000. This number is projected to increase by 1.26 million by the year 2036. And it's anticipated that by then there will almost be 393,000 people aged 80 and over, more than double the number in that age group now. The growth amongst older Māori, Pacific and Asian communities will be significant. Between 2013 and 2036, the Māori population is expected to have increased by 115%, Pacifica by 160%, and Asian peoples by 260%. People living longer are often faced with comorbidities and complex health needs. Our systems and workforce need to be prepared so they can keep up with the changing needs and expectations of our ageing population. And the coming health and disability systems reform provide a significant opportunity to do that. Through these reforms, we aim to create a strong and equitable health and disability system, which focuses on improving outcomes for people who are currently most disadvantaged. particularly Māori and Pacific peoples. We also know there are condition-specific groups, such as people with dementia, who face clear inequities depending on where they live in New Zealand, the age at which they're diagnosed, and the presence of other conditions such as intellectual disability. I want to talk more about New Zealand's data, as data helps us to understand, prepare, and ideally improve outcomes. It might be dry, but I remember the important lesson I was taught at medical school, that health statistics are human lives with the tears wiped off. By understanding data, we aim to improve real people's lives. Improving national data collection and information systems for dementia is an action area in the World Health Organization's Global Plan on Dementia, to which New Zealand is a signatory. The Global Plan acknowledges the significant challenges in achieving accurate data collection, from the ability to routinely gather information to accurately recording data and ensuring interoperability across information systems. We know these issues also exist in New Zealand. We see it when dementia goes undiagnosed, where there's an inaccurate recording of what type of dementia someone is living with, and when dementia is overlooked as someone's primary cause of death. District health boards and their community partners have built a significant amount of work into driving improvements in areas such as early diagnosis within primary care. But there is more to do. Those of you who, like me, are data nuts will know about the Inter-RI system. The Inter-RI needs assessments are an area in which key data is collected on dementia. And this data has been used to inform some of the analysis within the report being launched today. This data provides comprehensive and standardized information on cognition for people living in the community and in aged residential care. It paints a picture around things such as decision-making abilities, memory, and behaviour. Inter-RI data supports care planning, the ability to allocate resources to people who need it, and potentially helps identify undetected dementia. However, it has limitations. Because this data is only captured when people have Inter-RI assessments, it doesn't tell us about everyone with dementia and their carers, particularly those with mild to moderate those in the mild to moderate stages who are not receiving formal supports. In short, there are people out there with dementia who the health system knows nothing about. While it cannot provide a full picture of the prevalence of dementia in New Zealand, research is underway to look at how Inter-RI data can be used in conjunction with routinely collected needs assessment data. Using different sources of data to develop a national prevalence rate is an approach used in Australia in the absence of a national data set. This, of course, brings me back to the significant work that's gone into producing the Dementia Economic Impact Report. The authors have had to take an innovative approach to determining how prevalent dementia is in New Zealand in order to estimate its future costs. The findings in the 2021 report speak for themselves. They confirm projections in the 2016 Dementia Economic Impact Report that by 2050, almost 170,000 people will be living with dementia. And of course, we cannot forget that the impact is so much wider. 170,000 people with dementia means tens of thousands more care partners, whānau, and friends who are also impacted. One of the things I was pleased to see included in this updated report is the greater focus on data that has implications for how we understand equity in relation to dementia. As mentioned before, we know Māori, Pacific, and Asian populations are expected to significantly increase over the next few years. It is not surprising to see a corresponding projected increase in dementia amongst these populations. This includes a higher prevalence of younger onset dementia for these populations than for Europeans. This means a range and type of supports we should be providing in the future to what will have to be responsive to an increasingly diverse group of people with dementia, their carers, and whānau. I'm pleased to see the report also addresses prevention, as I like to bring a focus on prevention to all my work. The findings in this report also suggest the importance of reaching middle-aged New Zealanders to try and modify risk factors that they face and to reduce the projected numbers of New Zealanders who will suffer from dementia. My hope is through the health and disability system reforms we will see a more joined up approach to how we focus on modifiable risk factors common to most long-term conditions, such as heart disease, diabetes, and also dementia. The information outlined in the Dementia Economic Impact Report provides us with a strong evidence base and impetus to make a difference. This government is not ignoring the data. We are committed to supporting the implementation of the Dementia Action Plan, and policy work has been underway on this. The sector has been revising the action plan, and I received the updated version just last week. I'm looking forward to discussing it with my colleagues how best to implement it and working together with the sector to do so. There is no doubt dementia is a significant health challenge here and worldwide. Alzheimer's New Zealand has persevered in publishing a report that helps to grow our knowledge and understanding and to stimulate and encourage the kōrero about the social and economic impact of dementia in the future. The challenge is to take these learnings and use them for developing policy and improving support for all those impacted by dementia. Kia ora.
Thank you, Minister. Thank you for your support and your comments outlining the work that you've done so far and your ongoing data collection to support the work on our plan. And it was really gratifying to hear that some policy work has been done, and we look forward to discussing this with you tomorrow when we meet and further into the future. Now it's time to hear more about the details of what the report says and how the data was collected. So without further ado, I'd like to ask Dr. Itu Mau and Dr. Macarena Dudley from the University of Auckland to talk to us. Itu is a senior lecturer in the Department of Psychological Medicine at the University of Auckland, and he's a specialist old age psychiatrist at Waikato Hospital with a special interest in dementia prevention. Macarena is a clinical neuropsychologist and a senior lecturer at the University of Auckland. She is currently involved in a number of research projects investigating Maori and Ngāti Wairori dementia. So I now welcome Itu and Macarena to take to the screen. Thank you.
Okay. Tēnā koutou katoa. Nei rā ngā mihi māhana, ngā mihi maihoa kia koutou katoa, kua karapine pine mai ki tēnei hui huinga mo te kaupapa rangatira. Arā, ko te utu o te mate wareware ki Aotearoa whānui. Ko Itu Mau tēnei, e ahu mai ana i te motu o Tonga, he kaimahi au ki Waipapa Taumatarau. My name is Itu Mau, and I'm a senior lecturer at the University of Auckland and a consultant psychiatrist at Waikato Hospital. On behalf of the research team, I'd like to thank Alzheimer's New Zealand for the opportunity given to us to present this updated Dementia Economic Impact Report. Dementia is now a global health priority, and there are almost 50 million people living with dementia across the world at a cost of over $1 trillion US. And this is projected to double in the next 10 years. So dementia presents a major economic issue for all countries, including New Zealand. As Catherine said earlier, this is the fourth report on the economic cost of dementia at Aotearoa, using updated data to estimate the prevalence and costs of dementia in 2020. In line with previous reports, we've highlighted the rising prevalence and costs, but where previous reports have described an upcoming rapid rise in prevalence, we believe this report shows the surge in dementia is well and truly here. So the prevalence of dementia is increasing in line with the projections from the previous report. It's now estimated at almost 70,000 people and is projected to increase by 30,000 in 2030 to almost 100,000, and by almost 100,000 people in 2050 to nearly 170,000 people. As the Minister outlined earlier, Māori, Pacific and Asian populations are aging at a much faster rate. So in 2020, they comprise about 15% of the population of dementia cases. But by 2030, 40, they're going to comprise over a quarter of cases of dementia in the country. So this means that policies, interventions, and services will need to be tailored so they are acceptable and appropriate for the unique cultural needs. The total economic cost of dementia in 2020 was calculated at almost $2.5 billion, or just over $35,000 per person with dementia in Aotearoa. Social care costs, including aged residential care and community care for people with dementia, comprise the largest cost, with social care, with aged residential care alone accounting for over half of the total economic cost. Healthcare costs include the cost of inpatient admissions. Productivity losses are the result of people with dementia leaving the workforce early due to their illness. Unpaid care provided by family and whānau and carers is calculated at over $100 million. And these are people that would have otherwise been in employment if they hadn't been providing care. Projecting these costs into the coming decades, the additional 30,000 people with dementia means the cost will balloon by an extra $1 billion. And by 2050, the cost will increase to almost $6 billion in today's dollars, based purely on the increasing number of people. These costs don't factor in any rise in health or social care costs. But for example, aged care has increased by 20% since the last report. So by 2050, the economic cost of dementia is likely to be a lot higher than the $6 billion we have estimated. The last report in 2016 estimated costs would increase by 15%, but they've actually increased by 43%. And most of this increase is due to the increasing health and social care costs, with a lot of the costs due to the rising cost of aged residential care. Unpaid care is a hidden cost of dementia. And it's a huge cost, whatever the ethnicity. The way that unpaid care is estimated at the moment means that only a fraction of it is actually costed. But if we add in the total number of hours, over 1 million hours per week that people with dementia, carers provide with people with dementia, then the cost of unpaid care is a lot more than the 117 million used in the official report, and probably closer to over $1 billion. So where does this leave us? Our report highlights that we are facing unsustainable cost increases in the coming years, and there will be increasing strain on the health system. Our rapidly aging population means the economic cost of dementia will increase by over $1 billion in the next 10 years alone. We have shown that the burden of unpaid care is significant, over 1 million hours per week. And if this is valued at the actual number of hours being provided, is over $1 billion per year. We have shown an inequity in the use of social care, with lower use of aged residential care by Maori, Pacific, and Asian populations. And this is not balanced by a concomitant increase in community care. So they therefore carry a higher burden of unpaid care. We have shown that in the next 20 years, the proportion of people with dementia who identify as Maori, Pacific, and Asian are going to increase from 15% to over 25% of the total number of people with dementia. And this means that any policies, interventions, or services will need to be tailored so that they are appropriate and acceptable to our culturally and ethnically diverse populations. As the Minister alluded to, risk reduction and prevention is a priority. We know that if we can delay the onset of dementia by just 5 years, we can halve the number of people with dementia. And this can be achieved by targeting risk factors such as diabetes, smoking, blood pressure, and obesity. But we don't know how much we can actually do without having real data. And this leads me to my final point, that we need real prevalence data And we need a proper epidemiological study on the extent of dementia in Aotearoa, New Zealand, so that we don't have to extrapolate from overseas studies that are carried out in populations that don't necessarily reflect our unique communities. This has been a really brief overview of the economic cost of dementia in Aotearoa. I'd refer you to the full report for a more detailed cost breakdown and an appendix which outlines the methods. I'd really like to acknowledge the team who are instrumental in the development of this report. One of the team, Dr. Dudley, who I'll hand over to now, is going to talk about the impact of the report findings for Māori. Nō reira, mahi a te mahi, hei painga mo te iwi, tēnā koutou katoa.
I ngā mana, i ngā reo, i ngā kārangaranga maha, tēnā koutou, tēnā koutou, tēnā koutou katoa. Tēnā koe, Minister Verrill. Thank you for the opportunity to speak about the Dementia Economic Impact Report and some of its implications, particularly for tangata whenua. So one of the strengths of this report, I believe, is that it highlights some of the inequities experienced by Māori and other ethnic groups who are living with mate wareware. I'm using the term mate wareware because it is the term that is commonly used in Te Ao Māori for the term dementia. So the data for Māori in this report is quite disturbing for me because they reflect and confirm the concerns of around 250 odd people that we interviewed when we toured the country in 2017, asking people about their personal experiences of mate wareware. And at that time, there was widespread deep concern and a lot of fear, I might add, because people were starting to observe how common this disease was in their communities and were beginning to have some understanding and realise the financial burden on themselves and the whānau following a diagnosis of mate wareware. This is demonstrated in one disturbing set of data in this report, which shows a disproportionate number of Māori who are diagnosed with mate wareware at a younger age. 19% of Māori receive their diagnosis before the age of 64 years, compared to 8% of Europeans. And the data for Pacifica and Asians paints a similar picture, 18% and 16.8% respectively. The impact of a diagnosis on the lives of these people can be financially devastating. If an individual is employed, there is the possibility of reduced employment, absenteeism, and premature mortality. And if their partner is working, they often have to give up their job as well in order to take on the role of carer. But in actual fact, many of our whānau are the most deprived in this country and are unemployed, and a diagnosis of mate wareware places even further hardship on these already poverty-stricken whānau. Another set of data that I found very concerning, which has been alluded to already, is the amount of money spent on aged residential care, 87% of all social care funding. However, as we know, the number of Māori, Pacifica and Asians make up only a very small number of residents in aged care facilities, around 5% according to the 2017-2018 Interai database. And the reasons for this are varied. For Māori and Pacifica, it is largely due to our traditional values and practices where we prefer to keep our elderly at home, our kaumāori at home, within the safety of a whānau environment, so that we can approach their care from an holistic perspective, which includes the nurturing and the nourishment of their wairua, which is central to their health and well-being. So the burden of unpaid care is higher for these groups, although they are the most deprived groups in the country. So I feel there must be a change to equitable distribution of social care funding across people who move into aged residential care and those who, for whatever reason, choose to remain at home. As the situation stands, Māori are being bypassed when it comes to the bulk of the funding. In a sense, you could say they're being penalised for practising their culture. And I say this in light of our country's history, which is littered with policies and laws that have led to the suppression and the demise of many traditional Māori practices and Māori ways of being. So I really do hope we get this right. As Itu, my colleague, has already mentioned, because Māori Pacifica and Asian populations are ageing faster than Europeans in Aotearoa, it is vital that government policies address the issues of inequity in Mate Wareware. If this does not happen now, these inequities will continue to grow to a point where anything that is done will be too little, too late. Finally, I just think right from the get-go, this is a wonderful opportunity for the government to reflect their continuing commitment to honouring the Treaty of Waitangi, and in particular, their commitment to ensuring equal health outcomes for Māori living with Mate Wareware. Nō reira, ko motu taku kōrero, that is the end of my kōrero. Ngā mihi nui.
Thank you very much, Macarena. That was a very useful and insightful talk, as well as Itu. The data is quite horrifying, really, and hopefully it will be used to improve the people with dementia, their lives of people with dementia and their care partners. So we've now got time for a few questions. So Lynetta, have you got some questions? Who's the first question for? Thank you.
Hi, good evening. Yes, I've certainly got some questions here, Claire. The first question really is for Itu, Macarena and Catherine, and you could each add perhaps something to it. What is the most important thing that needs to happen now to improve the lives of the peoples of New Zealand living with dementia?
Oh, thank you, Lynetta. Itu and Macarena, it'd be great if you started this off, and then I'll finish up since I got to speak first.
I thought Macarena was.
Sorry, yes. Sorry. Where does one start? I think from the research that I've done, what I do know is that Māori do not have enough information about Mate Wareware, about dementia. I think we need to really educate and provide information for whānau so that they know what this disease is all about, what they need to face, how to prepare for it, how to empower themselves in order to, approach the onslaught of potentially of Mate Wareware that we might be facing. We need to be educating our whānau about prevention strategies, how to live healthier lives, because this is a disease that does not have to happen. So that's just one area. I think it's around prevention, around literacy, health literacy, providing our whānau with the information that they are needed in order to combat this disease. I think that's just one area of many. I might just pass it over there.
Over to you, Catherine.
Oh, no, go for it, Itu. No? Okay. Well, I think I absolutely agree with you, Macarena, that prevention and health literacy space is vitally important. And I think we heard that also from Itu and from the Minister. But if there's one thing from our perspective that just needs to happen now, that is a national plan and adopting the Mate Wareware dementia plan that we've worked on with our partners. And that's the one thing that we would like to see happen, and happen at pace.
Oh, I totally agree, Catherine. I think this is a wonderful blueprint for our way forward. And I'm very excited about the launch of the action plan tomorrow as well. Mm. But you're right, that's a good place to start, and then we build on that, and if we implement the actions that we have recommended, then, the future looks okay.
Yeah, it's a good place to start.
Yeah.
All right, you don't want to add anything to that issue? Okay, very good.
I just might add, of course, there's, as I said, there's so many different areas that need addressing, but I think it's very important that we look at the distribution of funding in an equitable way. I think that is really important because it doesn't appear to me that is what is happening now. And of course, and obviously this is further down the track from actually having the action plan implemented, but to have dementia services that are appropriate and meet the needs of our cultural populations, our ethnic populations, is that's paramount. Our Māori, Pacifica, Asian populations are just not relating to the services that are there currently. Some of them are better than others, I have to say. And some of the dementia services are definitely making a really good effort to include all New Zealanders, but there's a lot of work to be done.
Thank you all. Eshu, this is a question for you this time. Some of the estimates from the last economic report differ from what we find now. What are some of the reasons for this?
Okay, so by and large, the report has used the same methodology as the previous reports. There's a couple of places where it differs. One of those is in the estimates of inpatient hospital admissions and the cost of that. But what's interesting is that when we ran an analysis calculating it the same way as the previous report did, the numbers came out roughly comparable. Otherwise, particularly aged residential care and community care, most of the big costs are estimated the same way. So the explanation for the increase in cost is going to be the increasing prevalence of approximately 7,000 people, but more importantly, the increasing health and social care costs. We know, for example, that aged care has increased by about 15 to 20% in the last 5 years, and the cost of a carer has gone up significantly as well.
Thank you. And this one's for Catherine. Catherine, on the one hand, we say that we want people to get a diagnosis so that they can live better. But on the other hand, a dementia diagnosis comes with lots of stigma and discrimination that you talked about. So don't you live better by putting off having a diagnosis for as long as possible?
Thank you, Lynetta. Look, it is a difficult question, I think, because that stigma and discrimination is very real. But I think that, this is a question that we looked at in the research that we commissioned a couple of years ago on the lived experience of dementia here in Aotearoa, New Zealand. And that report is called This Is Our Story. And one of the things that comes through that report so strongly is how important a diagnosis is for people to come to terms with what is happening for them, the changes that are happening, the issues that they need to deal with, that it's being validated that there is something happening. It's important for the person, it's important for the care partner, and it's important for their whānau and family. And I think that alongside that is the reality that here most services are only available to people if they have a diagnosis. So I guess in summary, it's really important for identity and people's ability to plan and come to terms with the diagnosis, but it's vital also for people to get the help that they need.
Thank you, Catherine. The report demonstrates once again how critical it is that the new health system addresses equity issues. Can you tell us more about the inequity across the ethnic groups? And I guess that this is for both Eshu and Macarena.
Etu can provide the data.
So one of the slides that inadvertently got skipped over because I'm not quite sure what's happening with my system. There's a slide on, if I can share my screen. Māori, Pacific and Asian people use a lot less age residential care per person compared to Pākehā, and Makarena kind of touched on that. But what's really clear from the report is that for whatever, for all the reasons that they're not using aged care, it's not actually being balanced by an increase in the provision of community care. So that overall, the costs of social care for Māori and Pacific compared to European are about $5,000 less per person with dementia. And for the Asian population, it's closer to $8,000 less per person. And what that means is that if that care is not being provided or funded by the state, then the burden falls on family and whānau in the form of unpaid care. And I think that's where the big inequity is. The other big inequity is that a greater proportion of Māori, Pacific and Asian populations, of people with dementia, are of working age, under the age of 65. So they get doubly hit with the disadvantage of not being in care, but also losing out on the income from being in the productive workforce, from having to retire early because of their illness. And I guess that means that while the total economic cost per person across the ethnic groups looks roughly similar, when you break it down, the inequity is very marked.
Thank you, Esho. Macarena, do you want to add to that? You're very welcome now.
Well, it's nothing that I've already said. In that data that Etu was just producing, it confirms that that we, even more so, that we need to be looking at the redistribution of funding for especially social care funding in order to gain equity in this area. That was all I was going to say again.
Sorry, I think we might have time for one more. Esho, this is for you again. So we talk about health system cost increases, and that's really come through tonight. And we know that care partners are at a heightened risk of poorer health because of caring. Do we have any idea of the cost of their poorer health?
I mean, the short answer is I can't comment off the cuff on the cost, and I'm not sure what studies have been done on that. But what we do know is that the mental and physical health effects of being a caregiver for people with dementia is very taxing. And there's very good evidence that looking after someone with dementia and providing that care does become a significant burden after a while. It's why we were really keen on presenting the replacement cost of unpaid care rather than just focusing on the opportunity cost. Because if carers are providing care at 20, 25 hours per week or over 1 million hours per week total, then that's time that they can't dedicate to themselves and their own physical and mental well-being. And we know from the evidence from previous carer reports, for example, that carers across the board, and for people with dementia in particular, aren't looking after themselves. They go to the doctor less frequently, they have higher chance of comorbidities and a much higher chance of mental health difficulties like depression. So while I can't quantify it, there is definitely a burden there.
I'll just follow up on Etu's answer there, probably putting a slightly different hat on in terms of my role as co-chair of the Carers Alliance. because this is a big issue, this question about the impact of caring on the care partner. And one of the reasons why it's hard to quantify is because for most of our health and social systems, it's very hard for the care partners to be recognised in their own right. So they're usually considered and recognised only in the context of the person that they're providing care for. And so things like the impact on them and the consequences of that, both for their health and for and the cost of that can be harder to quantify. But we do know that, you know, carers do experience significant health impacts, mental health impacts, as well as physical health impacts as a result of that decision that they make to care. And they often find it incredibly difficult to get that recognised and to get the help that they need. Just one other thing I thought I would just mention, and that's because I think I didn't make this point earlier, but the Dementia Mate Wareware action plan that I was talking about earlier and that Macarena also was talking about, one of the things that we're very excited about that is it has been developed not just in partnership with our NGO colleagues, but also in partnership with the Mate Wareware Advisory Ropu. And so it is our first attempt to try and start on the journey of a truly bicultural plan that recognises and looks to tackle the equity issues as well as the general gaps in the system. So the beginning of the journey, but an exciting beginning.
Yes, I'd just like to tautoko to support what Catherine has just said. I think a lot of us will be pleasantly surprised when we look at the new Dementia Action Plan when it's launched tomorrow. It is definitely truly a bicultural partnership approach and one that I've been very proud to be involved in. So let's all look forward to tomorrow.
So thank you everyone who submitted questions, and to Lynetta who did a great job moderating them. We'd love to keep going, but our time is up. So just in conclusion, unfortunately the numbers, both human indicators and economic impacts, are only going in one direction, which reinforces the fact that dementia in Aotearoa, New Zealand is one of the most serious and costly health conditions after COVID-19. We all know the government has health priorities it can't ignore, dealing with the Delta variant and planning for when the next variant arrives, managing the vaccine rollout and ensuring equity to all communities. The health reforms still need to happen to help mitigate the gaping inequities in the system that we've heard about tonight. But woven amongst all these is the ever-present and increasing pressing issue of dementia. At some point, government is going to have to act. Otherwise, the impact on the health system will just become too great and they will be forced into action. The DEIR clearly indicates that. But at what point will they act? And how many New Zealanders must suffer in the meantime? That's the question that the government needs to answer. It's been a pleasure having you all with us for the launch of the 2020 DEIR, and thank you for joining us. Thank you to the Minister. Thank you very much to Itu and Macarena, and thank you to Catherine and Lynetta. I wish you all a good evening, and we look forward to seeing as many of you as possible at our conference to be held on the 18th and 19th of November, and due to COVID conditions, it will be entirely on Zoom. Please see the Alzheimer's New Zealand website for more details. So thank you very much again, and I wish you good night, and we look forward to seeing you all again another time.